going to provide you with a patient case scenario on hyperkalemia. Hyperkalemia is defined as a serum potassium level of greater than 5.5 milliequivalents per liter. Throughout this patient case scenario, we will provide you with information on signs and symptoms to be aware of, as well as possible lab findings that you might see and who to get involved in evaluation of the patient, treatment, and we really hope you enjoy this presentation. Thank you.
Here, is she perfusing her brain?
Hi, Mrs. Clegg. My name is Kaylee. I'm going to be your medical assistant. Do you have a list of your medication that I can give to your PA?
You know, I actually wrote them down because I just can't remember them right now. So
Perfect.
There you go.
Thank you. So I'll give this to your PA. And now I'm just going to take your blood pressure and everything before they come in.
Okay.
All right. So if you don't mind, I'm going to have you sit up here.
I'm actually kind of weak. Do you mind helping me? I feel very weak right now.
Of course.
So just,
There we go.
thank you. Thank you. Did you stop? Oh, goodness.
All right. Perfect. So let me get your blood pressure.
Okay.
Hi, I'm Alex. I'm a current PA student here at the Florida State University College of Medicine, and I'm just here to talk with you and see what's been going on before the PA comes in and sees you. So you're here to talk about your blood test results from last week, right? Has there been anything else bothering you?
You know, I had to write down my medications on a list of paper. I only have 2. I just feel like I'm so confused lately.
Okay.
And when the medical assistant asked me to get on the table, I needed her to help me. I'm feeling kind of weak too.
Okay.
And I've just been tired and my heart's racing.
Oh, I'm sorry to hear that. I did see the medical assistant, Kaylee. She told me that your pulse was 130, which is pretty high, and your blood pressure was 160 over 95. So I'm also a little concerned about that. But I meant to ask, I see you're on Synjardy, 5 milligrams, 1,000 milligrams, twice a day, every day, and Ramipril, 5 milligrams, twice a day. Have you been taking those consistently?
I've been taking the second one, but sometimes I forget my diabetes medication here and there.
Okay, so once or twice a day, maybe at all?
Maybe once a day, maybe no.
Okay, so that might explain what's been going on with your blood pressure and your pulse. Okay, so can you tell me a little bit more about your past medical history? I know you have diabetes, and I see you also have congestive heart failure.
So, funny story. I was, having my mid-morning snack of a Polar Pop, my favorite soda, Coca-Cola, and a bag of potato chips.
Mm-hmm.
And I was walking along, doing my thing, and then all of a sudden, I just dropped to the floor like a bag of potatoes.
Oh.
Yeah, turns out I had a heart attack. Who would have thought?
Wow.
So, now I'm trying to be a little bit more healthier because of that heart attack. That's why I incorporated the bananas in my oatmeal, and I'm trying to, watch out for that good fat, so I added some avocado toast.
Yum.
And here we are.
All right, well, thank you.
Yeah.
I'm going to go take this information to your PA, and she'll be in to see you shortly.
Hi, how are you?
I'm pretty okay.
Pretty okay. My name is PA Mandy, and I am here to talk with you about what's going on with you today. So, according to the history that my PA student got from you when you guys talked, and then
Lovely gal.
yes, and then also my lovely medical assistant, she came in. We all have our good days and bad days, but she came in and took some vitals on you, and according to everything else, I just want to go ahead and run some tests on you today. So we're going to go ahead and get some blood work done for you, a chemistry panel, and then we're going to get an arterial blood gas, and then we're also going to get an ECG on you, just to make sure your heart's doing okay and that everything's fine. Okay?
All right.
Sounds good?
All right. So the next thing I'm going to do is your PA wants me to take your blood and do your EKG. Is that okay?
Yes.
Perfect.
Hi, Ms. Clegg. I'm the laboratory technician, and I have your lab results here. And I can see that you are in severe hyperkalemia because you have a 7. Your potassium is 7. And also your glucose is 200. So it looks like we need to get your diabetes under control. Your BUN and creatinine are normal, so that's good. You do not have any kidney dysfunction. And your serum electrolytes, all your other electrolytes were also normal. So I'll give these results to the doctor, and we'll take care of you.
Hi, Ms. Clegg. My name is Sydney. I'm the cardiologist here, and I just wanted to go over a few changes with patients with hyperkalemia, your condition that we have going on right now. Things that we can commonly see, I can show if you'd like, is in your EKG, you will have, in the early stages is what you have present here, are peak T waves that are decreased. Later stages and things that we're going to be aware of are you can possibly have a broadened QRS, depressed ST segments, and prolonged PR intervals. And I know that's kind of a lot and doesn't really understand by looking at an EKG, but the biggest concern is that we're worried about is if we don't get this under control, that you could have sudden death through cardiac arrhythmia. That's why it's so important for us to make sure that we get your potassium levels under control, as well as your diabetes and your congestive heart failure.
Okay. Thank you.
You're welcome.
Hello there again, Ms. Clegg. Well, I talked about your results with our lab technician and with the cardiologist, and we have determined that you have something called hyperkalemia, which just means that you have a little bit too much potassium in your blood right now. So what I'm going to do is refer you to a nephrologist, which is a kidney doctor, and he's going to get you all set up with that and get you feeling better, okay?
All right.
I did just want to talk to you about a couple things. Since you are on an ACE inhibitor, you know, for your congestive heart failure, that drug you take for that, you're going to want to get routine checkups for that just to make sure that everything is going well. I also would like you to get checked up because you do have diabetes, and that's another risk factor for this condition, and I just don't want to make sure that this happens again.
Okay.
All right, we'll get you to the nephrologist.
Thank you. Hi, Miss Clegg. Nice to meet you. My name's Jolie. I'm going to be your dietitian, so I'm going to talk to you a little bit about your hyperkalemia, and you have diabetes, correct?
Yes.
Okay, so we can talk just a little bit about incorporating certain things that help you with the hyperkalemia and your diabetes, okay?
All right.
All right, so I know the PA told me that for breakfast you like to have oatmeal with bananas, correct?
Very ripe bananas, yes.
Okay, well, unfortunately bananas are really high in potassium, and because of your hyperkalemia, we kind of want to restrict your potassium to less than 3 grams. I know, I'm sorry. So just kind of be aware of how much potassium is in things. Some things that you can avoid are bananas, raisins, dates, potatoes, let's see what else, honeydew melons. Avoid honeydew melons.
Can I have my avocado toast?
You can. What toast do you use that on?
White bread.
Okay, so we'll talk about that. Definitely with diabetes, you want to avoid white breads, white rice, white pasta, white everything. So just we'll talk about that a little bit. So basically with hyperkalemia, I want you to kind of incorporate more fiber in your diet and try to eat things that have less acidity or that are less acidic in general, because with hyperkalemia, you're more at risk of constipation and metabolic acidosis.
That's a big word.
Yeah, so it's just basically your body can't handle the acidity.
Okay.
So try to decrease the acid, take in more fiber, which can be found in whole grains, beans, avocados. So those are things that you can take into account and try to intake more to help regulate diabetes and hyperkalemia.
All right.
Avocados do have potassium, but it's okay. I don't think it'll kill you.
Good. Can't take my avocado toast away.
I know, it's like, let's just take away the white bread. I think that's the worst part. Another thing I want you to kind of start to do a little bit more, if you can, is boil foods. Some studies have shown that maybe boiling, eggs and other things might make it a little less, might reduce the potassium in certain foods. Okay, so that might help. And just watch out for things that say low sodium or sodium substituted, because a lot of sodium substitutes
actually replace that with potassium. So you'd just be taking in more potassium, and that's
Tricky.
the last thing we want. Okay?
Okay, thank you.
No problem. And yeah, just remember, you can have your avocado toast, just put some whole wheat bread under that instead. And with your oatmeal, do you like berries, like strawberries?
I can do berries.
You can do berries? Let's try to replace the bananas for berries, okay?
No problem.
To treat the patient's hyperkalemia, we will start treatment immediately due to the severely high level of 7 milliequivalents per liter. We will administer calcium gluconate for prevention of arrhythmias plus IV bolus of regular insulin and 50% dextrose, followed by infusion of 5% dextrose. This permits potassium to enter the cells and move out of the blood, thus lowering the plasma potassium levels. Insulin is also a treatment for the patient's uncontrolled diabetes. Albuterol nebulizer and sodium bicarbonate can also be given as a temporary measure as they reduce the risk for cardiac arrhythmias and allow time for further assessment and treatment, such as hemodialysis. Hemodialysis is needed in this patient to correct life-threatening effects and the fact that the patient has other complex medical issues such as diabetes and congestive heart failure. Once the patient is at a stable level, we will discontinue any nephrotoxic drugs and continue treatment of their diabetes and congestive heart failure.